Miino, by Nutriverse. Miino contains myo-inositol, folic acid, vitamin D3, yeast selenium, zinc gluconate and chromium picolinate. It helps in the management of diabetes, PCOS, thyroid diseases, mental disorders, male fertility, fatty liver disease and other diseases. Diabetes. Myo-inositol reduces insulin resistance. Insulin is released by the pancreas in response to food intake. Insulin resistance happens when the body cells don't respond well to insulin and can't easily take up glucose from the blood. Different types of anti-diabetic drugs work in different ways to reduce blood sugar. For example, gliclazide stimulates the pancreas to produce more insulin. In the cells, myo-inositol is converted into second messengers such as IP3 and PIP3, which stimulate GLUT4 and increase glucose uptake into the cells. Clinical studies have shown that supplementation with myo-inositol 4 gram per day improved the blood sugar, blood pressure, and cholesterol levels. Diabetics have much lower myo-inositol levels in the kidneys, nerves in the legs and in the eyes. Myo-inositol supplementation delays or prevents diabetic complications such as kidney failure, nerve pain, and eye diseases. Polycystic ovary syndrome affects 1 in 10 women in their childbearing age. The underlying causes of PCOS are insulin resistance and high insulin levels in the blood, which lead to increased levels of luteinizing hormone. High LH levels reduce production of estrogen and progesterone, increase production of testosterone, and inhibit ovulation. This imbalance of hormones contributes to irregular menstrual cycles and infertility. Overactive male hormones leads to excessive body and facial hair growth, severe acne, and hair loss. Miino reduces insulin resistance and hyperinsulinemia, rebalances sex hormones levels, regularizes menstrual cycles, restores ovulation, increases fertility rate and reduces PCOS symptoms. Hypothyroidism happens when the white blood cells and antibodies are causing inflammation and damages to the thyroid gland tissues, leading to reduced production of thyroid hormones. A study was conducted involving 86 patients with Hashimoto's thyroiditis. They were given myo-inositol and selenium for 6 months. The results showed that the TSH and the thyroid antibodies levels were significantly decreased. Thyroid hormones, T3 and T4 levels in the blood were significantly increased. The subjects reported improvement in their quality of life. In the thyroid gland cells, myo-inositol is converted into IP3, the second messenger of TSH. Myo-inositol is essential for the synthesis of thyroid hormones T3 and T4. Myo-inositol levels in the brains are lower in patients suffering from Alzheimer's disease, strokes, panic disorders, insomnia, major depressive disorder, suicide victims, and bipolar disorder. A study in 20 people with panic disorders has shown that supplementation with 18 gram of inositol per day reduced the number of weekly panic attacks by 4 episodes, more than the reduction of 2.4 episodes per week seen in individuals on anxiety medication. In the brain cells, myo-inositol is converted into the second messengers, such as IP3, which are crucial for the signal transmission among the brain cells. Myo-inositol has therapeutic effects for anxiety, depression, panic attacks, and OCD. Myo-inositol reduces inflammation in the brain, protects the brain cells and improves cognitive functions. Male fertility. In a study, 176 men with type 2 diabetes were given either 4 grams of myo-inositol plus 400 micrograms of folic acid, or placebo. The results showed that the combination of myo-inositol and folic acid helped to prevent or treat erectile dysfunction in diabetic men. Miino helps to balance male hormones and increase sperm count and motility. Heart and blood vessel health. Myo-inositol removes cholesterol from the heart muscle, improves heart function, reduces calcification of coronary arteries. Liver health. Myo-inositol reduces fatty acid accumulation in the liver. In animal studies, deprivation of myo-inositol in the diet resulted in fatty liver condition in rats. Cancer. In animal studies, myo-inositol has been shown to be promising in the management of various cancers, including liver, lung, colon, and breast cancers. In conclusion, Miino helps in the management of diabetes, PCOS, thyroid diseases, male fertility, mental disorders, fatty liver disease and other diseases. The common dosage is 1 sachet of Miino, 2 times a day. For the management of mental disorders, a higher dose, up to 6 sachets per day, may be needed. Thank you for watching this video.